Hi everyone, this is Dr. Sarah Winward. I am a naturopathic doctor and a lactation consultant with your Downtown Doula. And I wanted to talk today about one of my very favorite positions for latching baby, and that is Cradle Hold. So I love this position because it's super simple. It doesn't involve any props. So you can do it anywhere you are. All you need is a chair. And it's usually very comfortable for parents' bodies. I have seen places on the internet saying that this is a hold that you should wait and use only with babies who have a little bit more head control, and I actually will say that I disagree with that. I think you can start using this hold as soon as babies are born, and it tends to be the most comfortable for both parent and baby. So I'm going to do the rest of the video from a parent's eye view so that you have an understanding of what to look for when you are latching. Okay, so I've got my breast and my baby, and the reason why this is called cradle hold is because you are latching on the same side as you are holding. So I'm going to be supporting my baby on my right arm, and I'm going to be latching onto my right breast. One of the things that I often tell parents is to tuck their elbows into their side. So a lot of times people will try and hold their arm out here, and that can be really tiring on your arm. So I usually recommend people tuck their elbow, and that also is going to give you some support on your breast, especially if you have larger breasts and you're finding you always have to hold your breast for your baby. Just tucking like this is already supporting your breast and giving you a little bit of that shaping. So you're going to hold your baby, and you want them to be supported on your forearm, and pretty high up on your forearm, to be honest. So they're not super close to my wrist here. They're like pretty high up on my forearm, and their head is tipping back a little bit. My arm is tucked into my side, and when you go to latch them, you're going to line up their upper lip to your nipple, and then when they open their mouth nice and big, you just put a little bit of pressure. My breast is moving around here. Putting a little bit of pressure through their shoulder blades here, and my wrist is actually about level with their shoulder blades. So if you see where my elastic is, that's about where I'm putting the pressure. And you can see, and especially with someone with larger breasts, they're getting a lot of good space in between their chin and their chest, so they have that nice extension in their head, and your nipple would be aimed for the roof of their mouth, and that is going to give you a nice deep latch. Super easy because you're supporting all of their weight with your bicep as opposed to with your wrist. And then make it even easier on yourself, you can lean back, and then now most of their weight is on my body as opposed to my arm. If you need a pillow or some sort of support, the only place you would really need it is just right under your, I'm going to take this out just to show for support. So you only really need it just under your arm, if anything at all. To be honest, this can be quite comfortable just as it is, because with leaning back, most of the baby's weight is on your body. Okay, and I just wanted to end off with a couple of tips. These are really common tweaks that I will often make for parents to make this position more comfortable and get a better latch. So in the cradle position, one of the most common things is I find that babies are too far this way, like towards your elbow. And what happens there is that in order to reach your breast or your nipple, baby has to do this with their mouth. And so I will call that a scooped. They're scooping on. And they're basically biting you when they do that, and it's also very hard for them to effectively stimulate your breasts. So what I will usually say to people is move their bum towards your opposite hip. So if they're up here, move them this way. Again, you really want their upper lip lined up with your nipple, like that, so that when you go to put pressure behind their shoulder blades, they are extending their neck, their head is coming backwards. So again, just tucking their bum towards that other hip, and then pressure through their shoulder blades. And here again, my hair elastic is where their shoulder blade is, and that makes for a very comfortable position for baby. The other thing that I will often see is with new babies, parents will hold their bums, which is fine. It's totally fine to hold their bums when they're new, but as they get older, then if you continue to hold their bum, their head will move that way because they're getting longer. So as your baby gets longer, one of the things that you can do, or if your baby is just big to start off with, is let their bum drop onto your opposite hip. So make sure you're holding their back instead of their bum. And as they get bigger, you kind of just let them hang here and let their bum sit on your hip. And then the last thing that I will often see in this position is if you're changing from a cross cradle, this, to this position, which is a totally fine thing to do. What often happens is that if you are holding your breast, especially if you have larger breasts and you're holding your breast into your baby's mouth, then as soon as you go to let go of your breast, it will fall and your baby will lose the latch. So if you want to start, if you're more comfortable latching in that cross cradle hold and then switching, just make sure, be really aware that you aren't lifting your breast into your baby's mouth, that you're going to where your breast naturally lies in space. If you have larger breasts, one of the things that can sometimes help with kind of giving you a little bit of lift is rolling up a baby blanket and just propping your breast up, and that will give you a little bit more lift and make it a bit easier. But then tucking your elbow is going to give you some support from the side, and putting your arm by their shoulder blade and then pressure through their shoulder blades. And that is it for this position. It's one of my favorite positions. It's a super easy one. Totally fine to latch newborns like this, and very comfortable, super comfortable for your shoulders, super comfortable for your arm, and that's the cradle hold. And one more thing I want to add to that latching and cradle, and that is parents sometimes will be holding their baby too high up. So take a look at where your nipple naturally lies in space, and you really want to bring your baby to your nipple. And we like to think that our nipples point straight forward, but they don't. They usually point a little bit down. And so if your nipple is pointing a bit down, you actually want to be bringing your baby on in that cradle hold a little bit underneath your breast, where they are then looking up at you a little bit, because that's the direction where they're actually in line with where your nipple is. So you want them to be completely in line with your nipple, not having your nipple facing this way and having them trying to latch on like that, because it's just gonna be easier and less painful for you. So if your nipples are pointing a little bit down, that means that you're gonna need to bring your baby on from underneath. I will often have parents roll their baby out a little bit. So if the baby's like this, I will often have parents just roll their baby out like a book, almost like you're turning your baby outward, so that they end up then looking up at you, which also is super cute.